Welcome to the Health and Wealth Power Hour, the podcast that provides you with the knowledge and insights you need to achieve physical, mental, and financial well-being. I'm your host, Harlan Pickett, a business consultant who's passionate about helping people achieve a more balanced and healthier life. Each week, we'll deep dive into topics related to health and wealth, including retirement income planning, innovative healthcare solutions, alternative funded health plans, and specific actions individuals and business owners can take to gain control of their finances, have access to affordable quality health care, and achieve peace of mind. We'll also be joined by innovative experts who will share their knowledge and insights on prevalent topics. So, whether you're looking to grow your wealth or improve your health, you've come to the right place. Get ready to be informed, inspired, and empowered. Let's get started. And welcome to the Health and Wealth Power Hour. I am your host, Harlan Pickett. Thank you so much for taking time out of your day to join with us. Hope that you enjoy listening to what we talk about each week and you are able to really get on board with the changes that need to be made in this country to make our healthcare system better, more accessible, and really administrated a whole lot better. I was talking to someone the other day that really agreed with me 100%, that said, you know what, there is not an overall problem with our health care. The biggest problem is the administration of our health care system. And I really think that was right on the mark, because overall we have good health care in the United States, but accessing that and then the overall administration of it has really failed most of America, as this most recent study has said that about 70% of Americans say that the healthcare system has failed them. That's a recent survey from American Academy of Physician Associates. And the reason why a lot of people feel this way, I think doesn't surprise a lot of us that are in this industry. Huge wait times for people to be able to see a doctor. Almost 50% of the people surveyed said that the doctor don't even listen to them, and they feel like he's just not paying attention to what their concerns are. I mean, that's a terrible, terrible situation. You're the person that is going to help me get better, or not, right? But you're not even listening to what my concerns are. No wonder people are unhappy with the healthcare system. It's really a situation where you're going to have overall dissatisfaction if you don't feel like someone's doing something as simple as listening to you. A lot of folks have skipped visits. There's been numbers on this for years, but it's 54% of those surveyed had skipped or delayed care in the last 2 years, with 40% of them saying it was due to cost. Not surprising. We all know the cost of health care is soaring. It is absolutely out of control. Well, it's hitting people more and more. And we talk about one of the crazy things that happens when you finally get that appointment. You wait weeks at some points to get that appointment, and you get in there, and then you have no time with the doctor, or the entire time the doctor's with you, they seem like they are extremely rushed. In fact, 2/3 of the folks that were surveyed say that they feel that the doctor or the healthcare provider that saw them appeared to be rushed during their time with them. That doesn't make you feel very confident that you're getting their full attention. They're rushed. They're not listening to me. Wow. That is simply irresponsible for those physicians or those healthcare workers, because the last thing you want your patient to feel is unimportant. And we know that a lot of this has to do with the influence of what the insurance companies have pushed these folks to do, the codes that you have to do, the procedures that you have to follow if you ever have any hope of getting paid, because that's what it really comes down to. They have to follow exactly what the rules are set. They have to have exactly the right codes. They can only talk to you about so many things because otherwise they have no hope of getting paid whatsoever. And they're already rushed. They're already feeling burnout. We see this over and over with physicians right now. And it's going both ways now, right? The patients are seeing it. They're seeing it's not patient-centered care. And so this is a huge, huge issue. One of the stats that I thought was a big, I think, plus, and I'm going to say it's a plus because people are seeing that there's a potential light at the end of the tunnel. They just don't know what that light is yet. But 2/3 of adults believe that their health would improve if they worked regularly with a healthcare provider they trusted. So think about that for a second. 2/3 say their health would improve. DPC, anyone? Direct primary care is the exact answer to the desires of these folks right here. The folks that they were talking to, those 2/3 say, man, I could feel healthy, or I would be healthier if I just had a relationship with a doctor. And that's exactly what direct primary care is designed to do. So I think that there are some answers out there. It's just getting those answers to the people that are facing this problem. You're not, if you were doing a survey of individuals that were going through direct primary care doctors and having some good nurse line steerage and some medical management and some bundled cash rates with different surgery centers that have great outcomes and high efficiency. They're also quality doctors with great outcomes and not a lot of readmittances. These numbers are not going to be 70% are dissatisfied. You're going to have a very, very low, if any, that are dissatisfied. I mean, you're always going to have some, right? Because you just can't please everybody. It doesn't make any difference what you do. But if you really look at the options and the solutions that are out there, that is what it's going to take to turn this thing around. We're going to talk about a lot of these issues, a lot of these problems that are coming to light. I mean, people really believe that healthcare sucks. And we're going to talk about that. We're going to talk about the reasons why they think it sucks and what the answers are for us to turn this thing around. We're going to talk about that on an upcoming audio room on June 20th. LinkedIn audio room. We invite you to come out to that June 20th, 11 a.m. Central Time. You can go and find me on LinkedIn and go to my events and go ahead and register for that. You also can go out to insurancebrokersuccess.com and find it there. We're going to invite folks to come up on stage, give your opinion on what's going on and what some of the solutions are. So we'd love for you to join us on that broadcast coming up here in just a couple of weeks. Well, we talked a little bit last week about socialized medicine. Every year, Bernie Sanders puts out his new idea for what socialized medicine would look like. There's a bill, it seems like, introduced every single year and has been for quite a while. But when you look at the numbers, when you look at this 70% of people overall, they're dissatisfied with the American healthcare system and believe that it's failed them. When you look at that, you realize that we're getting more and more. We're getting closer and closer. We're getting more and more down that road towards socialized medicine because people are getting ready to throw their hands up and say, well, you know what? Obviously, private industry can't fix it. Insurance companies aren't fixing it. Let's just let the government fix it. Well, we know for a fact that the government typically doesn't fix things. They change things, but they don't necessarily fix things. But if you would like to have a sneak peek at what socialized medicine or what government-controlled medicine in this country would look like, it's pretty easy to do. You can look at our current veterans hospital system, the VA. You can look and see how it is administered and the type of care overall that our veterans get, the loopholes that prevent the government from being held accountable whenever they do not provide the correct services or correct diagnosis. And if you look at those things and hear some of the stories that have gone on there, your view of having the government run our healthcare system may change dramatically. Today's two guests are a couple of gentlemen that I was blessed to interview back in February of 2023, whenever I was still doing my live radio show out of Houston, Texas. Both of these gentlemen are veterans. Both of them have had various different issues that were affected due to their service for this great country, and then their experience with the Veterans Administration. So I hope you enjoy what their stories are as far as content of what it can mean to our future and what it can mean to us if we allow ourselves to go down the path of socialized medicine, because it's not pretty. It's not something I think any of us would wish on our worst enemy, but it is very, both of them have overcame huge adversity in their lives. And I think that it is a great understanding for us to know that if you don't have a place that you can trust to turn to, then things can be much, much worse before they ever have an opportunity to get better, if they ever can get better. So you guys are in for a real treat. We got Curtis Ray Brown. He is the author of the book titled God is Bigger, His Amazing Rescue from Abuse, Addiction, PTSD, Divorce, and Despair. And we also have Brian Talley, who is a former sergeant in the U.S. Marine Corps. Both of these guys have incredible stories. Brian Talley worked diligently to make huge changes to the VA and actually had a bill named after him called the Talley Bill because a loophole law that was been on the books for 70 plus years needed to be changed in the VA so that people could actually get the care that they need. And he was very diligent in what he did. You guys are going to really enjoy hearing his story. So welcome to the VA reality show, as it were. Hope you guys enjoy it, and we'll catch you next time. Hey, we are truly honored to have Curtis Brown with us today. Curtis is a military veteran. He had a distinguished career, but he left the military with PTSD and also had some injuries, including severe neck and spinal injuries and chemical damage. He had to battle the VA about the existence of those, and that is not all. But he is a living witness to the truth that God can rescue anyone. Curtis, welcome aboard, buddy.
Good to be here. Good afternoon, everybody.
So, Curtis, I love what you have written. I got on and read some about you. Anytime someone goes through such traumatic situations and takes ownership of the fact that they were to blame for many of them, I do. I appreciate that because, hey, I know most of the problems that happen in my life are self-generated.
Yeah, choice is a key factor in a lot of things, isn't it?
It really is. It really is. And that's one of the things I read on there. You said he made endless poor choices. I said, well, he sounds like my kind of guy.
It's sad that I'll probably make endless more, but for the grace of God. Exactly.
But for the grace of God, which goes right back then to your book, which you are the author of the book, God is Bigger. And so you obviously named that book because of all the things you went through it was God that saved you from those and gave you hope and gave you an opportunity to have a real life without addiction and pain. But you had to get there first. So tell us about that. Tell us about your journey.
Well, I had to get there first. That's correct. And that started with recognizing the choices that got me to the place I was at. And I learned that a key factor is addiction. You've got to be able to distinguish, is this a physical pain or is it addiction pain? And so I had to break that down to find out. And I went to a rehab. I was in there 3 days. And I came out of there and I was free of addiction. It's kind of ironic because that was Palm Weekend. So, and after almost 20 years of the VA pumping me full of pain meds and psychotropic meds, I started going a different route and started the more of a natural route. I've had 2 years ago. I had to have another surgery on my neck. I had compression on my brain stem and fluid on my brain stem, and they had to cut half an inch of titanium out to get to my brain stem to release the pressure. They didn't think I was going to walk out of there. I had to learn to do everything again.
Wow.
And I'm still recovering from that. There is going to be another book coming out that will be more extensive than the God is Bigger. It's going to be the whole story. God just put on my heart to write, more in depth and bring it all the way up to the present of this journey. And it just, I've learned, the key factor, number one is you've got to learn to take care of this body. You only get one. And, we're not like a lizard. You cut the tail off of a lizard, it can grow it back.
Right.
We can't do that.
Right.
We've got to be able to identify physically what the ailment is. And unfortunately, I wasn't even told that I had fractured my neck in 2 places or fractured my spine in 3 places by the VA. They hid it for years. I had it. It was an outside doctor that found it. And I was going paralyzed. And the VA just medicated me more, and then they did 3 surgeries on me. And unfortunately put the wrong hardware in all 3 times and placed it in the wrong places and shattered more vertebrae.
Wow.
So I don't have faith in a healthcare system that's government ran. I just keep it simple.
Right. And I understand. And, I more or less talk about that in my side of the world, which, of course, is the health insurance, health coverage type side, whether that's an insurance plan. We work with health shares and other things, too. But the bottom line is if and when the government gets involved, things usually go haywire. I mean, look at Obamacare and look what has happened to the cost of insurance since Obamacare came along. It's nuts.
You look at our military. We used to have a really good, strong military. But the more the government gets involved in the military system, we don't have, for instance, I was talking to a commander. I work a lot with active duty now. And I was called to speak at 82nd last year after the Afghanistan debacle. Yeah. And they had me come up there to speak with them because a lot of the soldiers were struggling there at Fort Bragg. And I've talked to commanders at Fort Hood and numerous commanders around the country. And they say, and this is what you'll find interesting, is they'll tell me, they say, we're not having as much problem with PTSD or, the suicide issues or the drug addiction issues with so much as we were with the people returning from Afghanistan and Iraq as we are with our youth. And I said, I find that interesting. And he goes, well, I'm just going to, one of the commanders says, I'll put it like this. He goes, unfortunately, our youth are not prepared because they've never had structure in their lives to begin with, and they don't understand authority.
Right.
Well, that's the same thing we run into with the medical side, too. When there's no accountability, how in the world are you going to understand authority? And the VA system, there's no accountability. I fought them for 20 years I wasn't going to get any more. I was already fully medically retired, but I wanted them to be accountable.
Right.
That's all I wanted, them to admit what they had done. Well, 2 years ago, they finally admitted it, that they admitted fully to malpractice in numerous cases with me. Do you think I got a dime for that? No. The only reason I'm here is because I had outside insurance and I was able to get the proper health care.
Do you think that them finally admitting to it, it's one of those things where, ironically, the gentleman that's going to be on right after you is Brian Talley.
Yeah, Brian's a really close friend of mine.
And so do you think you finding out about that had anything to do with the Brian Talley VA Transparency Act?
Well, and that's something Brian and I talked about. And the thing is here's what, you would think they'd be accountable and even reimburse me for what I had to spend out of my own pocket.
Right.
That's all I asked for all the medical care, which was $2.72 million was the total medical care.
Wow.
John Snyder's a good friend of mine. He calls me the Bionic Soldier, and and I said, he goes, you think you could outrun the $6 million man? I said no, because they cut me short. They only spent 2.72 on me.
Yeah, you're almost half as fast as him.
That's right. I'm only half as fast.
Oh goodness.
So, but and Brian and I talked about that, but unfortunately, because of statutes of limitations.
Yeah. They like those, don't
they? Didn't they kind of, they drug their feet for a reason.
Right. Right.
Because they didn't want me to have they wanted the laws on their side. And unfortunately, they have most laws on their side because they create their own laws. and another thing you'll find interesting is Louis Gomert's one of my very, very close friends. And Louis had told me the first time I talked to him about this, and he fought the VA for me for years alongside me. And he goes, Curtis, here's the sad part. I can sit there and send them letter after letter after letter, but I can't make them do anything.
Right.
He said they're basically their own government-ran system by themselves.
And I think that we see that every time anyone, including Congress, tries to do anything there. In most cases, they're just beating their head up against the wall.
Exactly. That's exactly right. And then you get, and I've seen, and I've got really good friends within Memorial Hermann Healthcare System. Dr. Kerr Thompson, he was on my board for a while, and he's a chief of staff out of Sugar Land Surgical Center for Memorial Hermann. And he's known of numerous people, too, that worked for the VA system to begin with, good doctors, but got out of there because they were literally retarded from being able to do what they were called to do.
Yeah.
And so they said, I'm not going to stay here. And that's why they lose a lot of their good doctors and good nurses and stuff. It's because when you got people that are living the life of conviction, they say, hey, I can't stick this out. I mean, I can't even do what I'm called to do to really help these soldiers.
Right. I mean, you look even at your situation where there had to be doctors involved in this cover-up, right? There had to be.
Oh, yeah. Numerous.
Because they knew what was going on.
It's numerous. It's amazing how that works, too. I mean, doctors will cover doctors, and they don't care if they know them or not. And a lot of that is because of just the wisdom I gained through fighting the system is that they're covering them because of the cost of malpractice insurance.
Yeah.
Because they know if somebody gets in trouble and their malpractice insurance is hit, doesn't matter if they're involved in the case or not, that it's going to affect their malpractice insurance.
Right.
Cost.
Absolutely. That is absolutely insane. But I did see 19 surgeries. Wow.
Yeah, that's up to 24 now since then.
Oh my God! You need to update your bio, buddy.
I'm actually rewriting. Like I said, I'm rewriting it. It'll come out in around summertime. It's going to be a lot more have a lot more punch to it. I've had some people talk to me about when the rewrite comes out about being a movie, and so
yeah.
we're excited. It takes, you got to rehash all this stuff out when you write it.
Right. Well, where can people find out more about you? I see you're also a radio show host. Where's that show at?
Well, it was on KKHT 100.7 in Houston, but now I've moved to Corpus, and I'm the founder of Frontline Forces Foundation. You go to frontlineforces.com. We are actually right now revamping our webpage because we're going to be focusing on active duty as well as veterans as well.
Okay.
So,
okay.
What I found out when I was there, and where God really just touched my heart, speaking to 82nd, was reminding me about being in the war. And unfortunately, we are a reactive rather than a proactive military, and we're that way a lot of ways in the government and everything throughout our country.
Right.
And it just reminded me, why am I just working with veterans? When the earlier we address the injury, the better chance we have of full recovery. And these injuries are happening. Why do we have a huge veterans issue? Because the injuries weren't addressed when they were active duty, when it first happened. When you're on the battlefield, you don't say, "Oh, dude, I'm sorry you got shot. We'll deal with you when we get back to the States."
Yeah. Wow. Hey, I really appreciate. Yeah, I really appreciate you being on. It is time for a break. When we come back, we're going to get Brian on here to hear about his story too. Curtis, I look forward to maybe having you on again in the future, especially when your other book comes out. Love to have you back on and maybe get you on for a full show to talk about your entire story and promote your book too, buddy.
Sounds good. Thank you very much. Tell Brian hi, and amazing man that I really look up to.
All right, take care, buddy, and hey, have a blessed day. Time for a break. Harlan Pickett, be right back. And we are back. Harlan Pickett, Health and Wealth Power Hour. Thank you for being with us today. Sure hope that you guys enjoy listening to the journey of Mr. Curtis Brown and his battle against the VA and the injustice that they brought to him. Speaking of injustice, wow, our next guest took on that same VA. Not only that, but there was a loophole that was fixed by a bill that he fought for 6 years. And he was really dealing with a situation in his own life that left him in a physically in such a poor situation. It is amazing he could even truly survive this battle. But he made a huge impact on veterans at the time, veterans from the past, and veterans in the future. Welcome to the show, Mr. Brian Talley.
Thank you, sir. I appreciate you having me.
Yes, sir. Hey, it was great to meet you a few months ago out at the Fulshire Katy Chamber of Commerce monthly meeting. That is actually, we got to meet in person there. I don't. You probably don't remember me, but that's okay. I do remember you speaking and talking about your journey. So, I know that you know Curtis. He says he really looks up to you and he appreciates all the great work that you've done. But tell everyone your story, because I think there is definitely some parallels to what he has suffered, to what you suffered, but you were actually able to take some action.
Sure. It's about a 6-year story that I could try to sum up here in about 10 minutes for your show and for time. But, essentially what happened back in January 2016, or prior, December 2015. Look, I'm living the American dream. Been married over 20 years, served my country honorably, a contributor to society and 4 beautiful kids, community leader, coach. And then one day in January of 2016, I couldn't get out of bed. This led to months and months and months of delayed and denied care as I was laying in an incapacitated state, as my wife did everything she could to try to get me the emergency medical help I needed from the VA. The VA told her I was fine, that I had a low back sprain, which was strange because I didn't have any sort of trauma. They injected me with high-end opioids to include, Dilaudid and methocarbamol and Kenalog, and they just sent me home with bags and bags and bags of pills. 4 months down the road, I am opened up by a private surgeon in downtown San Diego, Scripps Memorial Hospital, and the doctors found a surprise as I lay open on the operating table that I had a bone-eating staph infection that was aggressively eating me alive for over 4 months, and that was eating my spine, spinal bone, disc, tissue, bladder, part of the kidney, you name it. The damage was done. The surgeon was appalled at what he saw. He called in infectious disease, and infectious disease, like I said, began to cut out that bone and everything that was infected in there. And, this typically doesn't happen in a first world country
Right.
because this pain is unlike anything you could ever imagine. Being eaten alive from the inside out is something that you can't imagine. You can't put words to it. And the amount of permanent injuries and damage it did to me. I'm very lucky to be alive. The infectious disease doctor said I should have died within about 10 days and that the infection should have went septic and shut down my organs completely. And then, essentially would have had a family with 4 kids and a loving wife of over 20 years without their father and leader.
Wow. And so you had this infection. Well, where did that come from?
Nobody knows. Nobody knows. The infectious disease doctor said, he thinks I picked something up overseas and that it was ingested somehow and it attached to my spine and laid in a dormant stage until one day it decided to wake up. And when it woke up very aggressively. And as it woke up, it began to do a slew of damage all the way up and down my spine that, has led me to have several surgeries. And I'll continue to have them for the rest of my life.
Wow. That is it's one of those things that no one can predict, right? It wasn't because typically you hear of those type infections after someone's had a surgery, right? It was they get something like that after they've had something and they catch it at the hospital, I guess you can say. Unfortunately, we hear those stories. But in this case, it wasn't some type of, bad situation at a hospital. This was the VA, in this case, the malpractice of them, was saying that there was nothing wrong with you, refusing to treat you.
Correct. Yeah, well, they didn't refuse to treat me. They treated me. They just wouldn't. They refused to give us a blood test. They refused to give me any diagnostic testing, but they did not refuse to give me injections, high-end opioids, and bags of pills. And really, that's where the problem lied.
Right.
It was the lack of empathy and actually trying to give me the emergency medical attention that I needed. I mean, I couldn't walk. I was in a wheelchair. I had a panic attack on the ER floor a couple of times when I was in there. I was in so much pain. And, I posed every red flag that there absolutely was that should have, given me that, that emergency medical care that that I warranted, if you will.
Yeah, and it's interesting because, not knowing that particular part of your story or not remembering that particular part of your story about them treating you in that way. One of the things that I had mentioned earlier in the show, even before Curtis came on, is that we seem to be in this system, in our healthcare system right now, of just working on the symptoms, just treating the symptoms, not actually looking for the cure of whatever's happening. But a lot of that, as I have really investigated this, a lot of this is not because of any other reason except for misdiagnosis in many cases. And in this case, that's what they did, is they misdiagnosed, but they didn't do anything to actually get a diagnosis. They just determined it on its own because, there you are laying kind of immobile, and, well, it looks like you probably strained his back. So that's what they treated you for.
Yeah, you're right. Treating the symptoms and not the cause of the problem. And, this would end up being one of the most egregious VA medical malpractice and gross negligence cases, we're in our country's recent history, unfortunately, but from there, we went on to file a federal tort claim because of the loss, the loss of my personal, my physical, my emotional, my mental health, my business. Wasn't working anymore. I was limited to a chair. The pain and suffering was real. the VA came out publicly as my story went national, and they pretty much accepted full responsibility, and they were very sorry and sympathetic about what happened. They stated that they were going to be settling my claim. At the 6-month mark, the Office of General Counsel calls me, and they told me that they were going to be settling the claim. And then at the 1-year mark, they write me a letter stating that they denied it based on a technicality in a loophole in the system that was established back in 1946 that states that if you are a non-U.S. government employee and you are working within the halls and the walls of a VA hospital, the U.S. government is not responsible for the acts that you commit while hurting another veteran due to negligence and malpractice.
Isn't that convenient?
Oh, it's nuts. Yeah, you can't make you can't make this stuff up. And the sad thing here is that the majority of the doctors and clinicians that are working within VA hospitals are all independent contractors as they're getting fed in from the local communities, colleges and universities and programs and residents. But they have VA doctor's coats, VA badges, VA business cards. They have everything that would state that they are a VA employee. I never knew before this even happened that there was ever such thing as an independent contractor working in a VA. I figured that if you're in a VA hospital, you're a VA doctor.
Yeah.
But that's just not the case here.
Right. And it's very interesting because that is a very common thing in the government now. They have really, over the years, they have switched to more and more contractors for the same reason others businesses have, is because, of course, it lowers the burden of having to pay for benefits. They also kind of get to test the waters, and sometimes they even have time periods where you have to be a contractor before you can even become a regular employee. That's something that the government has instilled too. So that's interesting. But I would guess that that this, once you got this letter, and then you realize there was a problem, this really at that point in time started your journey to fix this loophole.
Yeah. Once the medical malpractice happened to me, I was 99% done. I didn't really have anything left to give. I was so hurt and in so much pain. The physical pain still was just mounting. And then on top of this, we got the legal malpractice, and that was the kill shot. That was the kill shot that put me on my knees, and it kept me there for years until I finally had a coming to Jesus meeting with myself and said, you know what, my children are watching me. I need to be the leader that I once was and stand up and to begin to get 1% better than I was the day before. And I kept that same mentality. And when this all happened, I went to my congressman. 2 weeks later, my congressman was indicted on federal charges for screwing up in Congress, and he was forced out. So therefore, I now lived in the only congressional district in the United States of America that did not have a sitting member of Congress while I was battling the muddy and very dangerous waters of Washington, D.C. without zero representation. And so I had to take it upon myself to become an honorary member of Congress, draft my own bill, and I hand-delivered it to the very steps of the Capitol building where our laws are made. I walked those halls of Congress, going door to door, urging lawmakers to change this outdated law that has destroyed the lives of veterans and their families for generations. And 3.5 years of consistent lobbying. I had to teach myself how to effectively communicate with members of Congress and how to have meetings and to be influential. I had 4 bills that I drafted that were all introduced in Congress. And then on January 6th, 2021, one of the final acts of President Trump signed my bill into law that closed this loophole. But it's a very, very long story. I'm just kind of giving you the quick elevator pitch right now. But, we made history, and we changed this law, that now gives veterans due right process after, due process rights after they have fallen victim due to no fault of their own.
Yeah, absolutely. Yeah, and folks, if you want to hear more of Brian's story, you can go out to briantalley.com. That's BRIANTALLEY.com. ANTALLY.com. You can read more about him. You can actually order his book. Brian's also a motivational and public speaker, and so you can actually request to have him come out and tell his story. It's unlike any other story that you're likely to hear from any other motivational speaker. The way that he overcame all of these things, his resilience, his perseverance, and looking at these, and especially when you consider the shape he was in at the time whenever he had to truly pick himself up off the floor, like literally pick himself up off the floor to make this thing happen. So you are certainly, it's very encouraging, and it's really an honor to speak with you, sir, and we wish you all the best in the future.
I sincerely appreciate you having me, sir.
All right. Hey, you have a blessed one, Brian. Thank you. Harlan Pickett, Health and Wealth Power Hour. We'll be right back. And we are back. Harlan Pickett, Health and Wealth Power Hour. Wow, what some powerful stories from Curtis Brown and Brian Talley as they have taken on the government, and that is never an easy task. I'm telling you, folks, you should learn more about them. Brian's story is absolutely incredible. I really just found out about Curtis here recently, and his battle against the VA is also extremely powerful. Now, the one thing I don't want anyone to think is that I am not a fan of the men and women that work in the healthcare industry, because I truly am. There are a lot of good folks out there. There are times, however, when they are absolutely arrested by the conditions that they work in, whether that is working for a federal government system like the VA that makes them do certain things that they would not do normally, or working at the behalf of big insurance companies that do not allow them to completely do their jobs and fulfill what their oath was by moving people through almost like it is a process in a factory and moving you down the conveyor belt because they got to get to the next person. But I'm a big fan of the health care industry we have here in the United States. We still have the best place to get health care in the world. We've just got to fix the accessibility, and we've got to fix the places where we are not getting the quality